Hi, this is your Central New Jersey chiropractor, Dr. Perry Wolk-Weiss at the Get Well Center located in Bound Brook, New Jersey. And what I wanted to talk to you about today is one of the least known causes of lower back pain. If you're a lower back pain sufferer out there, you know how encumbering it can be to the quality of your life. You have a hard time getting out of chairs, you can't get out of the car, if you do have to do laundry and bend over, putting on your shoes could even be tough. There's one area that most people ignore when it comes to lower back pain, and I'm going to share that with you today. And we're going to talk about, it's called the rotated pelvis. And it shows up by seeing a short leg or a difference in the leg length on the patient. So we're going to talk about that today. Okay, so as I mentioned, we're going to talk about the rotated pelvis. And this is Roseanne who's laying on the table. And Roseanne, tell me a little bit about what's going on with your lower back.
The past couple of days, my low back has been hurting. It's like a deep ache. It hurts especially if I twist my waist to the left. It's been bothering me when I sleep. You feel this pull, and it goes right up the middle of the back.
Okay, great. Yeah, that's a common complaint I see very often. And one of the things when we're looking at the pelvic bone here, what we're looking at is the fact that you have your pelvis, right hip, left hip, and there's a bone in the middle, and they move as you walk. And what can happen is one of the hips can go out of alignment. Either the right hip can rotate backwards or the left hip can rotate backwards. And when that happens, that changes your gait, it changes the mechanics of the lower back area, and all of that starts to put stress on the lower back. It can inflame the sacroiliac joints, which is a joint right here. It can give you inflammation of the nerve, the sciatic nerve, and give you pain going down the back of the leg. That's one of the things it can do. In Roseanne's issue, she's got a lot of pain, really much going down here. So that's one of the areas where it's pretty tender. So what we want to do is we want to take a look at her leg length and see what's going on with that. And that'll tell me whether or not her pelvis is out of alignment. So we're going to look at Roseanne's pelvis. And what we look at, and the easiest way to see it is have the patient lying on their stomach and you look at their heels. I'm going to try to move out of the way so you guys can see this a little bit, and I brought a ruler. If you look at Roseanne's heel, the bottom of her left heel, right, is longer than the right heel. We call it a right short leg in her situation. Now they should be equal, but her right leg is shorter than her left. Now her legs are actually the same length, but what's happened is the hip is rotated backwards, so it pulls the leg up in an upward direction. And pulling in that upward direction, she's literally walking around like she has one shoe on and one shoe off. So once again, you can see it. You can see the difference here in her leg length. How much is almost a ½ an inch difference in her leg length. And basically how we fix that simply is by putting some wedges underneath her pelvic bone. We'll put wedges underneath her pelvic bone here. And I'm going to put those wedges underneath. Stay. That's good. Put a wedge there. And put this wedge here. And what that wedge does, if you take a look at her leg length now, you can see that it evens them out. They're nice and even. And no, we don't have to tape those to her body and have her walk around like that for a long time. Basically, she's going to lay on here and we're going to apply a little bit of pressure onto the hip area. And from that, I'll move the camera up a little bit so you guys can see that. There we go. So we'll come back and apply a little pressure here. And then we'll take those out. And if you take a look at her leg length again, we can see that they stayed nice and even. And that evenness of her leg length means that her pelvis is back in alignment. And I've seen this be responsible for creating knee problems. I've seen this responsible for creating sometimes as far up as the shoulder, but mostly we see commonly in the lower back and occasionally ankle problems. I had a patient come in with an ankle problem that was constantly giving her a situation when she ran, and just by balancing her pelvis it took care of it. All right, so as I mentioned, We call it a functional short leg versus a structural short leg. A structural short leg is where actually someone has a shorter leg. The leg is actually different. In that situation, we have to put a heel lift in their shoe or build onto their shoe. But what Roseanne had here is a functional short leg. And I see it a lot. It's very common. It's something we look at every single day in the office. And if you're suffering from lower back pain that just doesn't seem to go away or it keeps coming back over and over and over again, this is something you really want to have someone take a look at. It is very easy to fix if you know how to look for it. How's it feeling now, Roseanne, just laying here?
Much better. The pulling is gone. The deep pain that I felt is much less.
Yeah, and we'll do a lot more work on her lower back in addition to that because she's going to need an adjustment for lower back. But like I said, if you're having chronic lower back pain, chronic sciatic pain, and it's not going away and it's constantly coming back over and over and over again, if you're having a hard time tying your shoes, you can't get out of a chair, getting out of the car is tough, you really should have one take a look and see if you have a difference in your leg length because your pelvis is out of alignment. Restoring those new normal biomechanics, getting this whole area back functioning again, can make a world of difference. This is your Central New Jersey chiropractor, Dr. Perry Wolk-Weiss at the Get Well Center located in Bound Brook, saying stay healthy.